We are leaders. It says on the sign that we are leaders in collegiate rec. I believe that we are leaders in health and well-being, and I think we need to own it, and I think we can own it. So I want to share a little bit about what that means. So first of all, what is health and well-being? When I go out and speak to non-enlightened audiences, the typical answer is diet and exercise. And it's not received well. People don't want to diet, they don't want to exercise. Those are things they feel that they have to do, they don't want to do. So diet and exercise are not things that we do. They're not health fairs. They're not exercise paths or walking paths. They're not the crazy busy that we talk about. You know, we talk about trying to find a work-life balance. There's no such thing as a work-life balance. It's a harmony. How do we harmonize our lives so that everything flows, our physical, our emotional, our spiritual, our social, and our professional well-being? It's also not wellness. I know that's a buzzword we use. It's a buzzword of about 10 years ago. Health and well-being is much more complex, much more broad, much more scientific. So what is it? It's really about who we are. It's who we are as we live for each moment of the day, as we live our lifestyles to be the best that we can be in every moment. We are striving for excellence in every moment. And we tend to strive for perfection in everything all the time, and that drives us crazy. It's who we are each and every moment, within it for ourselves and for our community. So why is there this national focus on health and well-being? We're not killed by saber-toothed tigers. We're not killed by plagues. We're not killed by famines. We're not killed by the acute things we used to die from. We die instead now of chronic behavior choices. The overs, the overspending, overeating, overstressing, overtexting, over-violence, over all of these overs that's what we die of. Heart disease is our #1 killer right now. 14,000 deaths per year. You know, remember the Ebola outbreak? There were 2, but remember the hoopla about that? We don't have hoopla about our health and well-being. Sorry, I have to look at my notes. We need to think more about upstream. Our students are, their #1 cause of death for our students is actually accidents. It's accidents. We think it's suicide, but it's not, it's accidents. So we have to really look at the data. But we have to look upstream. And I'm going to tell you a little story. Anybody familiar with the upstream thoughts and what that is? There's a lot of ones up here in the front. Upstream is actually a public health concept. And so I'll tell you the story what it is. So there's these fisher people, and they're out, and the fish are jumping. Here's the stream. The fish are jumping, imagine it. And they're just, they're casting, they're catching all these fish, they're pulling them out, having a fabulous time, wonderful time. And lo and behold, coming downstream, there's this person that's drowning. And they're like, help, 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 pull me out. So like, whoa. So they take the person out, they bring the person over here, they get the person taken care of, they get them off to an ambulance, get them taken care of, and they go back to fishing and thinking, well, that was weird, right? So they're fishing and having a good time again. It happens again. Another person's coming down the stream, and help, 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 pull me out. So they pull them out, get them taken care of, get them to the emergency room. They're like, well, that's really weird. So they go back to their fishing and still catching their fabulous fish. It happens 3 times, 4 times, 5 times, 6 times, 7 times, and they're like, what the heck is going on? So they go upstream to find out what's going on, and they find that there's a cliff. And people are looking over the cliff at all the fabulous fish that are jumping, and they're falling in. And then they're coming downstream. The downstream effect is all of the overs. We spend 80% of our healthcare time and resources, whether we're in a university or a national healthcare, on the overs. Whether it's diabetes, whether it's counseling mental health, whether it's overweight, any of those things. We need to spend our time up here, upstream, so that the people don't fall in and we have to take care of them down here. To do that, though, this is where you guys are poised for this. Because we want to keep them not only from falling in the water, we want to keep them back here away from the cliff. We want to keep them up here, flourishing, happy, enjoying life. We say at Georgia Tech, we want to be smart and happy. That's what our students want to be. They want to be smart and happy. And it's interesting because our Surgeon General, who could talk about anything to improve the health of the country, doesn't talk about the overs, doesn't talk about the obesity epidemic or the heart disease or any of that. He talks about happiness. Happiness is what will improve the health of our country. And he talks about happiness as being activity, connectivity or engagement, which we talk about a lot, kindness, gratitude, and mindfulness are being present in the moment. Where we excel here in NIRSA is keeping people up here flourishing. When you do health behavior change, there's 5 things you have to pay attention to, and then one's the individual piece. Individually, we are all responsible for our own health and well-being. But if it were easy, we would all do it, right? But you guys do that every day. You give our students and our employees the skills necessary to have a healthy lifestyle, the skills